Hello everyone, thanks for coming. Okay, so I'm from Redfern Legal Centre. We're one of many community legal centres. We're based at Redfern Town Hall. We have a staff of about 25 people and we provide a range of legal services both to our local community and also we have some statewide services. So we've got employment law, we've got an international student service, we've got a credit and debt service, police complaints, quite a large tenancy service, and the one I'm here to talk to you about today, which is the Health Justice Partnership. Okay, so I'm going to talk to you about the rationale for health justice partnerships, about our particular partnership and what it looks like, and about the results of an independent evaluation that was undertaken by Sydney University recently in relation to part of our service. So firstly, the rationale. So I have a couple of questions to start the presentation. The first one is for you to think about is true or false? Can the law impact people's health and well-being? So I want you to just have a little bit of a think about that. And I'd like to illustrate what I think is the answer by giving you a couple of case studies from our service. So first of all, and the names have been changed, Uncle Tom's story. So Uncle Tom is an Aboriginal elder and well known in the Redfern community. And he regularly attends the dental hospital, which, as I'll tell you soon, is one of the places where we have a health justice solicitor. And he was seeking treatment for a painful abscess. This greatly affected his health and well-being. And he was chatting to his oral health surgeon about some of the problems that he was experiencing, and they included homelessness, Centrelink debt, problems with the Australian Tax Office, and several unpaid fines amounting to thousands of dollars. So he was able to, through our health justice partnership, after mentioning those to his oral health surgeon, immediately gain access to our health justice solicitor, who's sitting here in the front row, Brian, who was able to give him immediate advice about all of those issues. Uncle Tom was very apprehensive and fearful about some of those debt issues and was mistakenly believed that he could be in trouble with the police because of some of those debt issues. So our lawyer was able to gain his trust, explain to him that it was not a police issue, and immediately set about resolving those. We contacted an Aboriginal service provider in relation to the immediate housing issue and organised some short-term accommodation and ultimately some long-term accommodation for Uncle Tom. We managed to get the fines waived through the SDRO on the basis of Tom's financial and other situation, sorted out all of the problems with Centrelink, which were corrected, and he got onto the benefit that he was entitled to and was also back paid, and also sorted out and confirmed that he didn't owe any monies to the ATO. And so for the first time in a long time, Uncle Tom was much less stressed about all of that and will be sleeping during the winter in his own accommodation. So I think that points to the real connection between people's legal needs and their health outcomes. Okay, question 2. How many legal problems, on average, do Aboriginal people have each year? And the reason that the data I'm talking about in these couple of questions relates to Aboriginal people is because that's the focus of the funding and the services that we provide. So perhaps turn to the person next to you and tell them how many legal problems you think Aboriginal people have each year. Okay, so the answer is more than 3, somewhere between 3 and 4. What percentage of Aboriginal people do not get assistance for their legal issues? Again, have a little chat. Okay, so 70%. And that figure was published by the Law and Justice Foundation of New South Wales, which undertook a legal needs analysis of Indigenous people in 2013. So who are people with legal problems most likely to go to for advice? again have a chat. Thank you. Non-legal professionals, unfortunately. So this is the rationale for the Health Justice Partnership. It's about addressing this evidence and utilising partnerships between health professionals and lawyers to create pathways for people who have unmet legal needs. So, our Health Justice Partnership is about early intervention, so getting people before they reach crisis point. And as I've explained, it's about reaching people who wouldn't otherwise be seeking legal assistance. We conducted our own survey of clients a couple of years ago, and 80% said they would not have approached a lawyer for the legal problem, which we were then able to assist them with. And lastly, it's about addressing the social determinants of health. So as I'm sure many of you know from your jobs, health professionals can't always get at the root cause of people's health problems. Poor housing, crippling debt, domestic violence, and family breakdown. And sometimes it's really such a relief for health staff and social workers that we work with to be able to work with lawyers or refer clients to lawyers who can address these underlying issues. So as you can see from this quote, the World Health Organization has also done some research and into the importance of social and environmental factors in driving poor health outcomes. In Australia as well, there's been some research and a landmark 2012 study found that over 1/5 of people in Australia experience 3 or more legal problems in a given year. Many of those don't seek advice for those problems, but when they do, they're more likely to ask a non-legal advisor, such as a health professional. And health justice partnerships have, come to Australia later than they have overseas, but the evidence that has really underpinned them, it was recognised in other jurisdictions and has been around for a very long time. Okay, so our particular partnership. So we have 2 health justice solicitors at the moment. One is based at Royal Prince Alfred Hospital, and we've had that service going for almost 5 years now. It's open to all area health service patients. Some of you may have come across Sue Ellen in the past, and currently the solicitor is Luke Carr. And then we were fortunate enough to obtain some additional funding probably about 12 months ago, something like that. And we've been, after consultations, we've decided to place Brian, who's an Indigenous solicitor, at the Sydney Dental Hospital, and he commenced there earlier this year. So the key features of, the partnership are the relationship that's established between lawyers and health staff, so the lawyer being embedded as part of the service and being able to develop those relationships which facilitate referrals. Very important is the informal and formal training that we undertake for health staff on identifying legal issues. So sometimes our clients and the health professionals we work with are surprised that issues like fines, like housing, like domestic violence, like debts, they have legal solutions. Lawyers can assist with those issues. It's a flexible service with a high level of support and a level of hand-holding for very vulnerable clients. It's trauma-informed, and importantly, our lawyers are not mandatory reporters. So some of the great work that we do at RPA is for women who use drugs and whose children are at risk. And they require help and support from treatment agencies and welfare services, yet often they fear engagement with services because of the risk of having their children removed. So in that way, the mandatory reporting obligations can create challenges for creating trust and engagement. But solicitors are accepted from such mandatory reporting requirements, and so this underpins some of the strengths of the HJP at that service. And I'll come back to that. So we're seeking improved health outcomes to alleviate strain on the legal and health system, and also to produce systemic change. So from our work and from our evidence base, we're able to also, at a higher level, engage with law reform activities and policy submissions around the issues that we're seeing affecting our clients. In terms of service utilisation, we have the data for RPA here. We've seen over 400 clients in that period there, overwhelmingly women in that particular service. And we provide a range of services to them, from full representation to one-off advice or assistance with legal tasks. And those clients, most of those clients, we would have provided assistance on multiple interlinked legal issues. As you can see, there's some of the legal problem types that we've assisted with. At RPA, a lot of child protection, family law, tenancy, fines and debts, domestic violence, and a range of other issues. And because I'm running out of time, I'll skip quickly to the independent evaluation. So it found some key positives for the service. One, that it's a non-judgemental, compassionate service. This is one of the quotes from our clients. I'll let you read it, but it's about, not being judged. I'll just read the highlighted bits. He didn't judge me by my looks, that I'm on drugs or that I'm on methadone. He didn't if or buts me or question me. He straight away believed everything that I said, etc., etc. So it's, my faith is restored. So a trauma-informed practice. This independent evaluation was undertaken by the University of Sydney, Dr. Maya Moenstad, and Associate Professor Carolyn Day. So we really take the time to talk to people about their cases and to gather their full story. It's also about consistency. So we see many clients at that level of vulnerability getting really frustrated by being referred from lawyer to lawyer and service to service depending on their requirements, whereas this is a service that can really address in a holistic way all of people's legal needs and work together in partnership with the social workers to address both the legal and non-legal needs. And that's the kind of partnership I'm talking about. And the evaluation picked up on this mandatory reporting issue as well, and found that having a powerful advocate in the form of an on-site hospital-based solicitor to whom clients can disclose their full details without mandatory reporting concerns allowed clients to divulge the depth of their problems, often leading to longer-term resolutions rather than band-aid solutions. And just, again, the report found the benefits of having a powerful advocate could be quite profound. And this is an example of someone who says, in the last two lines, we assisted her to make sure that she had visits with her children who were in care. And she says, I missed 5 years, 6 years straight, all because no one done it for me and I didn't really know how. And our health justice partner solicitor was able to make it happen. So I encourage you to find out more about whether your clients are eligible for our service. We have a stall in the market area, whatever you call it. Come and have a chat with myself or my colleagues there. Come and have a chat with Brian if you have time, and refer your clients. We have brochures at the stall. Thank you very much.